For a lot of women, menopause is a bad word. It is associated with aging. It is associated with loss of womanhood, loss of fertility, and with all the wrong hype about menopause, they feel that once they reach that stage in their life, they would then become old, look haggard, have a lot of medical problems, and essentially lose their self-worth. And for many of them, it is a difficult time to face, and they don't want to face this time. And because of that, they are reluctant to come in for visits to the hospital to learn what they can do to make things better for them during the menopause and help them through that stage in their lives. About 20% of women actually breeze through their menopause without much symptoms. But for a good number of women, they may have joint pains, muscle pains, they feel tired, they can't sleep at night, they have concentration problems, they may feel very hot and have what we call hot flushes, or wake up at night feeling very sweaty. So perimenopause is a phase just before menopause, where the periods have started changing and this woman can actually experience symptoms. Perimenopause can go on for even 3 to 5 years, so that irregular periods, the symptoms coming along, and one day when she does not get periods for 1 whole year, that's when we call her menopause. The normal transition age for menopause would be between 45 to 55 years, and the normal age to menopause in this country so far is between 50 to 51 years. Menopause also brings a change to the way a woman looks, and especially to the fact that she actually can gain a little bit of weight. Unfortunately, the weight is more central. This is because that estrogen that is not there anymore in their body has actually changed that weight distribution for them. Unfortunately, this weight gain depresses any woman. At the same time, it can also increase their risk of having other metabolic issues, diseases like diabetes mellitus, high blood pressure, high cholesterol levels. With the loss of estrogen in menopause, there can be changes to the internal organs of that woman. So we are looking at the heart, where her cholesterol levels can start climbing slowly. We are also looking at the fact that she can get calcifications in her blood vessels to the heart, and we call it atherosclerosis. And this can then increase her chance of having heart disease. We also know that it can affect the bones. Her bones get more fragile. And this can actually start way before the last period. It can actually start in the perimenopause. And when that starts then, by the time she is 5 years into menopause, she could have lost about 20% of her bone. And we know that estrogen is very important for how the brain functions. So when we talk about menopause, we are also now concentrating on how to keep the brain active, the brain alive, so that the risk of concentration problems, memory issues lessen. And what can we do about improving our brain health? So these are the main areas that we look at. But we should also not forget the vaginal health. They can get a lot of dryness in the vagina. Sex becomes more difficult. There can be relationship problems with partners and husbands. They can have increase in urinary tract infections. They can have increase in vaginal infections. And again, all these things actually can make them feel loss of self-worth and feeling very ashamed of the fact that they don't feel like a woman anymore. So in the initial days when I was in Pantai Hospital, Kuala Lumpur, I was concentrating more on obstetrics, which means looking after pregnancies and delivering babies. But along the years, as I grew older with my patients, I have been concentrating on women's health as they get older, and especially as they go through the menopause. As a gynecologist, listening and trying to help them through this phase is very important. A lot of women are fearful of what changes that they would go through. And listening and calming them down, helping them through their anxiety moments is very important. And many times it's just holding their hands through this change, which actually helps them realize that this is something that they can do. They can do it on their own, they can do it with our help, and allow them to actually live a very much more healthier life as they get older. And for some women where their symptoms of menopause are actually affecting their quality of life, we actually talk to them about menopausal hormone therapy. Menopausal hormone therapy is actually replacing that estrogen into their body, and we actually give them small doses of estrogen to correct that imbalance that they're having. So many of them who have these hot flushes, it goes away. Many of them who have got joint pains, it goes away. Their headaches goes away. They feel much more energized. They are sleeping much better. Panic attacks, anxiety moments, all decrease. And in many ways, it recorrects them to that woman who she was before. Their capabilities at work, at home, their relationship with people around them all become much better. And menopausal hormone therapy, we know, is very safe for women who are going through this change or within that 10 years of menopause. We have actually learned so much about menopausal health in the last 10 to 20 years. We know that the loss of estrogen causes a lot of changes in the body, which we did not know, say, in the late 1990s. We know more about the fact that the loss of estrogen to the heart, to the bones, changes actually begin in the perimenopause rather than once a woman hits her final last period. Women going through the menopause transition, a lot of them are actually struggling silently and they don't know where to go for help. And many people around them might actually think that their moods are changing and they become cranky for other reasons. These women actually need so much of support. Everyone should know about the fact that menopause can change their mother, their wives, their sisters, their family members. And if it does change the person that they love around them or they respect or they work with, they should be guided about where to go for help and how help would actually make them feel much better for their future. So menopause is not to be worried about or to be shunned away, or it should not be associated with any stigma. In fact, we should actually look at menopause very positively, take it on, and breeze through our later years of our lives.